NUR 610 Healthcare Systems for Advanced Nursing Practice, Summer 2014. Group QM-7 End of Life Care. Project name, Guardian Angels. Participants, Claire Thompson, Olivia Weiss, Scarlett Wade, Mallory Watson, and Amanda Young.
Our organization is called Guardian Angels and will be located within walking distance to the Children's Hospital in Birmingham, Alabama. Guardian Angels is a respite care facility targeting children with cancer where they can receive quality care at the end of life and where their caregivers can receive the support they need to cope with a dying child. Having the facility located in an urban metropolitan area will offer convenience for patients and family members to their doctors and other facilities, and residing centrally to multiple healthcare facilities is going to allow Guardian Angels to be publicized and utilized by care providers who practice in our area. Guardian Angels will serve as a place of relief for caregivers and family members of the patients, and we will provide services ranging from symptom and pain management to emotional care and support for the patients, families, and caregivers. Care will be provided in an inpatient 10-bed home-away-from-home setting, and the facility will be broken up into 3 different wings according to age. Wing 1 will be ages 2 through 6, Wing 2 will be ages 7 through 11, and Wing 3 will be ages 12 to 16. The administrative team is going to consist of a CEO and an administrative vice president. Nursing leadership will consist of a nurse director and a charge nurse per distinct wing. The facility will be staffed with nurse practitioners, registered nurses, patient care assistants, counselors, religious support staff, physical therapists, business support staff, environmental staff, and dietary staff. I want to briefly mention the macro, meso, and micro systems of Guardian Angels. First, the macro system will consist of Guardian Angels and the adjacent Children's Hospital and other oncologists and medical specialists specific to the patient individual diagnosis that are involved in the overall plan of care. The meso system will be the larger supporting framework, which includes patient care assistants, counselors, religious support staff, physical therapists, business support staff, environmental staff, and dietitians. And finally, the microsystem will be a small medical team of registered nurses and pediatric acute care nurse practitioners. Together, the 3 systems are going to create a solid network for the pediatric oncology patient population within the developed community of practice. Now we're going to talk a little bit about our healthcare population. Guardian Angels will serve the male and female pediatric oncology population, ages 2 through 16, in an urban metropolitan setting, and we will serve patients of every race and from every ethnic and socioeconomic background. We would like to point out a few statistics based on our healthcare population, and according to the National Cancer Institute, the annual incidence rate of childhood cancers from 2006 to 2010 was 15.2 per 100,000, with an average of 195 annual cases. The average annual count for Jefferson County, where Birmingham, Alabama is located, was 33 cases, and more than 90% of Alabama children diagnosed with cancer will seek medical care at Children's of Alabama. In 2012, 130 children were newly diagnosed with cancer, and there were 300 pediatric oncology patients receiving treatment at Children's of Alabama. The average annual death count from 2006 to 2010 for pediatric oncology patients in Jefferson County was 5 deaths per year. Here we have shown some of the statistics of different types of cancers in children ages birth to 14 years. And although the incidence and prevalence of specific cancers vary with age, the most common types of cancers overall among children and adolescents are leukemia, brain and central nervous system cancers, soft tissue cancers, non-Hodgkin lymphoma, kidney and renal pelvis cancers, bone and joint cancers, and finally Hodgkin lymphoma. Now we want to discuss the social and behavioral determinants of our healthcare population. The social determinants include availability of community-based resources to meet specific healthcare needs, access to a wide range of healthcare services, transportation options, social support, socioeconomic conditions, literacy, and culture. Behavioral determinants include emotional health, compliance to healthcare regimens, diet, physical activity, and hand washing. In terms of social determinants, financial resources can affect a patient's access to a full range of healthcare services, both acute and long-term, if a family lacks the ability to pay. The availability of a respite care facility may be affected by the family's financial stability. Socioeconomic factors such as literacy, housing, and living conditions can also impact a patient and family's ability to understand the implications of their disease process, as well as their understanding of the full range of resources a respite care facility may offer them. Cultural beliefs and rituals also determine views of modern health care and its ability to address the physical needs of the patient, and this could prevent some patients from benefiting from our respite care services. Behavioral determinants encompass the patient and the family member's overall understanding of the disease and treatment plan, and their level of compliance with that treatment plan. One behavioral determinant, emotional health, can affect the pediatric patient and their caregiver, and it will have a definite effect on the patient outcome. Emotional health of the caregiver can also have an impact on the siblings' needs being met. Siblings can experience issues such as poor diet, lack of exercise, and feelings of neglect, while their parent is caring primarily for the patient.
Our team will include a CEO, nursing supervisor, nurses, nurse practitioners, patient care assistants, counselors, religious support staff, physical therapists, business support staff, environmental services, dietitians, occupational therapists, pharmacists, and child life specialists. Each department will work together as an interprofessional team to create one large team. There will be pediatric acute care nurse practitioners that will manage the daily palliative need care of the patient and family. There will be an on-site, on-call nurse practitioner available 24/7 in case any emergent needs arise. We found a few facilities like Guardian Angels, one in Baltimore, Maryland, and one in Phoenix, Arizona. There's not a current one in the southeast. This is why we designed our facility for Birmingham. There's a great need for a facility like this in Birmingham. This could greatly impact terminally ill children and his or her families.
Guardian Angels will accept various forms of payment, including Medicaid, private insurance, and self-pay. Grants will be applied for, and the money will be used to provide services to individuals who cannot afford private pay or whose insurance does not cover all of the services. Although some individuals have insurance, this may not cover total expenses. Therefore, grant money and government assistance will be utilized to aid these individuals in their expenses. Guardian Angels will offer services to everyone despite financial status. No one will be turned away.
A memorial scholarship fund will also be in place to help cover expenses for families that cannot afford these services. This will allow families in the community who have been helped by our facility to give back to other families during their time of need. An operational budget has been outlined to estimate the initial cost of Guardian Angels during the first year, which will include building cost, utilities, medical equipment, office supplies, a business license, liability insurance, advertising, and employee salaries. A license will be issued to our facility by the Alabama State Board of Health after the board has determined that the facility is in compliance with state regulations. This will be renewed yearly at an annual cost of $1,000. Building costs for the facility are projected to be approximately $2 million for a 20,000 square foot building at an average cost per square foot of $100. Utilities are estimated to be $2,000 per month for an annual cost of approximately $25,000. $15,000 is being allotted for office supplies, including computers, printers, a fax machine, as well as more basic supplies such as telephones, paper, pens, etc. It will be necessary for an organization such as ours to obtain liability insurance, and we plan to insure our facility for up to $3 million in liability, which will cost approximately $50,000 annually. Also, salaries of the employees are included in the operational budget. In order to obtain and keep valuable employees, we will offer competitive salaries that are at least average for the Birmingham area. $2 million is the estimated cost of salaries for 1 year. Based on these figures, the total operating budget for the first year is approximately $4.1 million. In order to sustain our facility during the first year, we have already received a $100,000 donation from Children's Miracle Network and $500,000 from donations in the community. These will be spent on initiation costs. In addition, applications for $250,000 of state and federal grant monies are also pending.
Guardian Angels is a hospice facility specialized in the care of pediatric oncology patients. This facility is unique in that it is centrally located in an urban area approximated to the state-of-the-art teaching children's hospital. The facility is organized to group children of the same age together to allow for interaction if desired. Patients will be cared for using innovative technology and by the use of evidence-based care in connection with their medical doctors. Advanced practice nurses will not only manage the facility, but serve as a bridge between the patients and their specialist. Our facility mission coincides with the International Children's Palliative Care Network. Their mission states, "Children's palliative care is a basic human right. Children have very specific palliative care needs that are different from adults. Providers of palliative care require specialized knowledge and training, and the voice of the children should be heard and acknowledged." With these principles in mind, Guardian Angels seek to provide quality, pediatric-specific palliative and respite care by providers specifically trained in the provision of this specialized type of care. Quality and safety metrics that will be used to measure success will be reported by utilizing health information technology to evaluate treatment of patient care, review of evidence-based care outcomes, and patient-parent surveys, and the measurement of mortality and morbidity rates. Outcomes will be reported to national agencies such as Healthcare Effectiveness Data and Information Set and to the Patient Protection and Affordable Care Act. These organizations allow healthcare providers to assess themselves comparatively against competition that includes data related to clinical outcomes. Safety will be measured by accreditation and licensure through organizations such as the Department of Health and Human Services, Joint Commission on Accreditation of Healthcare Organizations, and the National Committee for Quality Assurance. Outcome reporting may also be required by insurance companies to monitor spending, such as the Center for Medicare and Medicaid. Patient-parent surveys will also be utilized locally to measure satisfaction and seek improvements in the care that is provided within the facility. We will strive to rank nationally and locally in the top 10% of providers in our specialty. Not only will we seek recognition from regulatory agencies, we will seek to ensure that satisfaction from our patients and family members. In our facility, we will utilize health information technology to improve the efficiency, accuracy, and reliability of healthcare services. Health informatics can be applied and utilized by any healthcare organization. However, for our pediatric organization, we will use informatics technology to implement current evidence-based care, monitor patient treatment outcomes, maintain patient privacy, provide networking with other medical facilities, for project management, and for the use of electronic health records. We can also provide storage of public health data, assist in the analysis of public health data, and provide health surveillance and epidemiology. By utilizing informatics technology, we can provide competitive, up-to-date care for our patients.
An important portion of the PPA-CA is Section 3132 that enforces controls on hospice recertification beginning on January 1st, 2011 that can ultimately provide limitations and complicate the ability of facilities to provide end-of-life care. It is also stated the general rule is that a patient must be declared to be terminally ill, defined as being within 6 months of death, if the disease takes its usual course, to be certified into hospice care. This translates to the concept that a patient may be recertified for continued hospice care as long as the patient's status is considered terminally ill. Recertification can only occur after face-to-face encounters between patients and hospice physicians or nurse practitioners. This relates back to cost concerns and the potential for financial abuse and the government being taken advantage of, which is why this portion of the PPA-CA was put into effect.